To highlight the trends and innovations shaping the future of healthcare. So joining us now from this year's event is Houston, Texas, is Todd Pickard, the Vice President of the American Academy of Physician Associates. Thank you so much for joining us this morning.
It's my pleasure. Thanks for letting me be here.
We're excited to talk with you about this. So can you tell us what the latest news coming out of AAPA 2024 is this year?
Yeah, absolutely. This is a great conference. Thousands of PAs from across the country are gathering here to learn about how we can better care for patients and use the new innovations around AI and around wearable technologies that empowers our patients. We're learning about early diagnosis of Alzheimer's disease. We're networking. We're doing great events with the youth out here with our Project Access. It's a great time.
Todd, how are new technologies impacting the future of healthcare?
You know, we are learning just the tip of the iceberg right now. AI is already in the clinics. It's writing notes. It's helping us prepare orders. It's helping us analyze data. Patients are already talking to AI. Sometimes they don't even know it, but there are always clinical humans involved. We don't let the AI take over everything. And there's also wearable technology, so the patients are empowered with their own data, understanding their blood glucose levels, their blood pressure, their heart rate, how many steps they take. My cameraman is wearing a wearable device right now that lets him understand what's going on with his own body. That is going to empower us. These tools will empower us to make sure that patients make right choices and that we can let them do more at home and have better access to the healthcare team.
So, of course, over the last few years, we've heard a lot about workforce shortages in the healthcare industry. Can physicians associates help alleviate that problem?
Absolutely. You know, PAs are ready, willing, and able. We've been around for about 60 years. We diagnose, we treat, we prescribe, we educate patients. I think one of the things that will help empower PAs to fill in more of those areas is we have some old laws on the book. We have some of the laws are from the 1980s. We need to modernize things so that PAs can do more of what we're trained to do, which is really care for our patients. So absolutely, we're here, we're ready, and we're growing. We're building a pipeline. PA profession is a great career. It's growing by 26% over the next decade.
So what kind of role do those PAs actually play in addressing healthcare disparities?
You know, healthcare disparities is really about connecting patients to what they need. And PAs are really, our superpower is listening and connecting and doing those resources. So if you can't find healthy food, if you can't get your prescriptions, if you don't have transportation to get to your appointments, PAs listen, understand what the patients need, and connect them to those resources. So absolutely, PAs are critically important to reducing healthcare disparities, but really just giving patients what they need.
All right, Todd, where can our viewers go to find out more information?
You can learn all about PAs by going to PAs Go Beyond, PAsGoBeyond.com.